Thanks.
Today I'm going to try and do an update of the work that's being done in Western Europe associations. I've included 11 countries that I think will really well show the work that's being done in all associations. I'm not going to talk about the UK because Karen North will have her own presentation in just a little while. I chose to start with a quote from Nelson Mandela that says, "After climbing a great hill, one only finds that there are many more hills to climb." I chose this one because I read it somewhere and I immediately thought about the work that we do as patients' organizations and the way we feel that whenever we accomplish one goal, we have so many others that we want to accomplish, and it seems that our work never ends. I will start with Italy, our host, and Italy, the Italian Association is really active, and they've been having home augmentation therapy since January 2013. The Italian Agency of Drug has approved it, and it's a great deal for Italian patients that can have their own treatment in their own houses and don't have to travel to hospital. They also have a genetic screening going on. It's called Alpha Havis, and the aim of this screening is to evaluate the prevalence of alphas in Italy, and also to map the territory and to promote an early diagnosis. The Italian Association is also promoting two kinds of meetings. One, it's called the treaters meetings, and it's held with physicians and lung specialists who treat their patients with replacement therapy. And the aim of these meetings is to inform and to up-to-date clinicians on latest evidence on the treatment. And they also have another kind of meetings held between patients and physicians. And these meetings, the goal of these meetings is to promote the relationship between physicians and patients, and so that they together can analyze every aspect of the disease. And moving to Austria. Austria has been organizing every year a patients meeting where half of patients can meet each other and be up to date to everything about Alpha-1. They also have a new website, and they also are working in a really interesting project. It's an Alpha-1 Austrian hub, and it should be available in smartphones and tablets. And they have also a Children's Day. They are organizing a Children's Day where Alpha-1 children can meet each other and can be together. In Germany has much more public interest for Alpha-1 in TV and radio and press. As you can see, there's been lots of articles being written about Alpha-1. German alphas have the luck to be able to attend almost every weekend a different kind of event, because there has been events not only of Alpha-1 but also COPD events or lung diseases. And they are also organizing a Children's Day, which it's been a great success, as you can see in these pictures. Moving to Denmark, Norway, and Sweden, I put them together because these three countries are trying to work together and to be stronger and even more effective promoting awareness to Alpha-1. There's also been some awareness campaigns, and the aim of these campaigns is to educate physicians and to see them how important it is to have replacement therapy available to their patients. And they are also having some meetings with the Danish Lung Society, and the aim of these meetings is to bring up young doctors and to make them committed to Alpha-1 cause and to study Alpha-1 and hopefully to be the doctors that will treat the patients in the future. In Belgium, there's a really interesting project going on, and they started with a small group of patients. They have meetings with professional psychologists, and the aim of these meetings is to so that they can speak about the disease and the problems they have and the difficulties that they have in their lives. And it's been a great success, and patients are willing to try that again. And they also have a new website page with a really nice image. Ireland. Ireland is also a really active association. They've been having a screening. They screen over 13,000 Irish people. And from this screening, they got 450 real severe alphas and 1,900 HEMZs. So it's a huge project, but with really nice results. They also are organizing an annual conference to Alpha-1 patients and for their families. And they had the recognition of the Minister of Health, who visits Alpha-1 Foundation. And they also got an award for the program that I just talked about, for the National Targeted Detection Program. In France, France has a new newsletter since December 2014, and with this that they can up to date their patients and their healthcare professionals. They are participating in several rare diseases events so that they can promote awareness to Alpha-1. They have a really nice project going on, and it's an online fundraising so that they can support research in France. And they have also a family information weekend where they invite Alpha-1 patients to be together for a whole weekend and to meet each other and exchange information. And in my neighbor country, Spain, Spain is investing a lot in communication, so they have a new website page, a Facebook page, and a newsletter. They are trying to reach for more patients and to be more effective on promoting awareness to Alpha-1. And they also are having some Alpha-1 registry campaigns so that patients can understand the importance of being registered in Alpha-1 registry. And the last one, Portugal, my home country. In Portugal, we have a new Facebook page since last year. And for us, it was a great surprise because we managed to increase the number of Alpha-1 associates. And we also got in touch with new Alpha-1 patients that didn't know we existed. We also are keeping on publishing our newsletter. It's called Alpha-1 Info. And we are having a great feedback from health professionals who are always willing to work with us and to give us information so that we can share with our patients. Last year, we also published some booklets for patients, one for children and their families and another one for Alpha-1 adults. We had a meeting with the Portuguese Health Commission where we presented the association, we presented the work that we have been doing and some of our concerns about the healthcare system in Portugal. And we also started an awareness campaign, in hospitals. So we go to the biggest hospitals in Portugal. We try to meet the health professionals that are working with our patients, and we give them some materials so that they can pass on the message to their patients. And with Portugal, I hand up my presentation. Hope you like it, and thank you very much for your attention.